to the Weekly Bioanalysis, a KCAS podcast.
Hello and welcome to the 44th episode of the Weekly Bioanalysis, the official podcast of KCAS Bioanalytical and Biomarker Services. KCAS is a bioanalytical CRO serving the pharmaceutical and biopharmaceutical industries for over 40 years. My name is John Perkins and I've been in the bioanalytical LCMS space for over 26 years. I'm here with my co-host, Dominic Guarino.
Hello, my name is Dominic Guarino, and I've been in the ligand binding assay and cell-based assay space for a little over 27 years now.
So Dominic and I are senior scientific advisors at KCS, and either or both of us are available to answer any questions you may have regarding this podcast or any of KCS's services. I'm located in upstate New York, Dom is in Kansas, and our producers are in Missouri and Kansas City, so we are all over the map. We are thrilled to have you listen to the 44th episode of this podcast, which is now available virtually everywhere. Wherever you choose to find and play your podcasts, you can now likely find the Weekly Bioanalysis. We welcome all of you, whether you're joining us for the first time or if you're a regular listener. As many of you know, if you've listened to any of our previous episodes, we started this podcast when COVID restrictions prevented us from continuing business as usual. We were unable to meet colleagues face-to-face, but we want to continue communicating with all of you. The podcast was an idea we'd always had, but it suddenly became the perfect medium for us to employ. Today's podcast will be a review of the latest news and resources and then a focus on the topic of our choosing before discussing any feedback we've had from you. We're constantly looking for topics and we'd be happy to discuss something that you want us to cover. Then we'll wrap up and give you a little teaser for the next episode, letting you know what's coming in the future. So again, we're fired up to have you here and we're looking forward to a fun episode today. A quick note though, last week's topic talked about a recent controversy that became more prominent in the news. As we reviewed our discussion, we thought it made sense to hold on presenting that piece of the podcast, and we may hold that to a later date for when things have become clearer and more resolved. So to kick us off for podcast 44, Dom is going to go over today's podcast topic a bit before we jump into the news and resources section. Dom.
Yeah, John, we got a jam-packed show. As always, we'll go over a little bit of latest news on COVID, and then we'll touch a little bit on some non-COVID news, and then maybe even a little bit of investments this time around. Also, today's main portion will be discussing evolving challenges of COVID with the emergence of the Delta variant. It's a lot of the emergence of the Delta variant. This is a very exciting topic. We're going to first discuss mutations in general and the natural lifespan of viruses. Then we'll dive into how the variants are tracked and touch a little bit about some of the technologies and the impacts of trying to monitor these things. And then we'll nicely move into the origin of the Delta virus and observed health challenges, some of the geographic status of the Delta variant, the impact on the patient population, and again, emphasizing vaccinated versus unvaccinated. And if time permits, we'll talk a little bit more about the role of Bioanalytical, specifically in dealing with emerging variants. So, John, we got a jam-packed show. You want to kick us off with the news?
Yeah, let's go to the news. First topic is we're going to talk for a few vaccine things. There's been a few developments that have been interesting. First of all, mix and match COVID vaccines. The case is growing, but questions remain. So what there's been a number of studies. First findings actually were at an institute in Madrid talking about combination of vaccines rather than sticking to the same regimen. And there's also now been studies in both the UK and Germany that are following a similar sort of path and have come to similar conclusions. And some of the trigger of this was actually for when early on in its authorization stage, the AstraZeneca vaccine had some concerns over possible safety signals. So investigators then thought, well, if we're looking at that, why don't we give them a jab of something else? And what they're seeing is that actually they get very strong response with both, but they're actually the two they've primarily focused on have been AstraZeneca and Pfizer BioNTech. So they sort of complementary mechanisms are given a strong overall resistance to the virus.
Yeah, John, what struck me most from this was this. A lot of talk about the safety of a vaccine, and here we are. There are people who are mixing and matching them, and we got people who are, not even willing to, take it in a very controlled environment. So that's the first thing. There's seems to be no effect, right? That no adverse effects from mixing and matching, and then more importantly, the efficacy. Which, again, this gets back to really how do you contain this, or how are we actually going to remedy it? We need worldwide vaccination, and so now doesn't matter if you got vaccination A or B. If you're in a resource poor nation, you just take whatever vaccine's available. So I get why it's being done, and all that is just great. I think it's good news, and I think this only continues to make me feel even more comfortable about having gotten the vaccine.
I agree. I mean, they talk about the small trials because they tried to set up a large trial to study this is really difficult in the current environment. But in terms of safety, they haven't seen too many adverse effects. Actually, the UK had seen them, but the Spanish and German hadn't, and they're attributing that to the time between the different doses. But there's actually other ongoing studies looking at other different combinations because you're right. As you get to other countries, it becomes logistically more difficult. And it might just be, well, I had this one a few weeks ago, but we've run out of
Yeah.
it. So we've got this other jab. Can I take that instead, and will that help? And it seems that based on the work that's been done today, that it's still a good thing. I mean, it's interesting. The quotes in the article talk about if you can get the same regimen, go for that. That's really the best way to go. And ultimately, it comes down to get whatever you
Yeah.
can in your arms so you're vaccinated. And I agree with that.
John, I don't think we understand how great we have it in this country. There's no like LabCorp clinic, or there's no CVS you can go into. People are a lot of countries you have to walk like half a day to get your shot. If you show up and they don't have it, like that person's not coming back, right? So like we don't. I think we don't understand, like most of the world has a much different infrastructure, and so there is no CVS, Walgreens, or
Well,
whatever
yeah,
on
I mean,
every corner.
when you think how remote some places can be to get vaccines and things out to them is it's a challenge in itself.
Yeah, no. Anyhow, we can move on from this one, but I think it's for those that have any, reading these types of stories only reinforce the safety of the vaccines. So anyhow, John, let's talk about. By the way, you sent me something from the Irish Times, John. I think this is the first time I've ever had anything from the Irish Times. So thanks for that.
Yeah, this is definitely not a good fierce biotech and endpoints. First one was from Nature. This is from the Irish Times, and I love human race is really intriguing about how much it thinks about stuff and what way different countries have different approaches. And this is Belgium. So Belgium in the early days of the virus really had a really bad. They had high level of cases and fatalities, and they were cited as one of the worst places in Europe in terms of dealing with COVID. But as things have settled down, they actually have a COVID-19 commissioner, which I thought was interesting.
Yeah,
There's quite a few
yeah.
quotes from him. But anyway, the headline of this is Belgium imposes ventilation rules for businesses to combat new COVID sources. I think I love this type of thing because we've known for months, we've talked about it frequently in the use every so often I'll stumble across things online where people are showing that there's the animations to show that if
Mm,
how aerosols disperse in a crowded space and things like that. And we've known that for COVID, because it's mainly transmitted through air, that if you're in a crowded space with poor ventilation and someone infected is in that space, there's a very strong chance you're going to become infected too. So that's why for in the US the mask mandate really said outdoors you're fine because the risk of transmission outdoors is minimal. It really is down to indoors. So Belgium have actually formalised this with their COVID-19 commissioner has basically they've mandated that public venues are being fitted with sensors that display how much air customers are sharing with others in an attempt to combat further surges of COVID-19, basically in preparation for autumn and winter when people start to go indoors.
yeah.
So the sense that they use carbon dioxide sensors, they cost about €70. And so basically they say should the business open doors and windows to increase circulation of fresh air to prevent transmission. It's a simple fix. It's a lovely simple
Yeah,
fix that
it's
actually could really be helpful.
well. But then
Um,
they do point, right. Like they do point to the enforcement of this. Like say it does go in breach, and then what does it mean? And
sure,
that. But
yeah.
but I love it, right? Like this is. I would love to be able to go into a place and know they're censoring it. And then, they're going to run into older buildings and schools and stuff. And then they said they had a fix for that too. So, and that's, to install some sort of air ventilation system that, there are air filters and things of that nature to really, I guess it has to do with like carbon dioxide levels, right? That's
Yep,
basically
yep,
what they're
yep.
kind of recycling out, and obviously that'll remove the virus, right? So,
Yeah, so
but good.
so
Hats off to Pedro Facon. I think that's how you say that.
yep,
What a wonderful job they're doing, John. Great,
yep, yep.
great story here around.
Yeah,
Like you said, it's eclectic to see what nations are doing, and yeah, I think it's really cool.
just saying, if this is so, just here's how they monitor it. If the sensors show carbon dioxide levels of 900 to 1200 parts per million, venues are required to take action to improve it, and anything above that level is a safety breach. It will be enforced by inspectors who will issue warnings if they find sensors are not displayed, and after a 3-month phase-in period, will begin issuing fines to businesses that do not comply. So they actually have displays for people to see what the level is before they even go into
Yeah.
into a facility. So you can, I mean, if it's looking a bit iffy, you don't feel comfortable going in there, you go somewhere else. Mr. Facon Faison, I'm not sure how to pronounce
Fasson.
his
Yeah,
name.
maybe it's Fasson. You're right. Yeah.
Yeah, is definitely committed to this, and he obviously schools sees as a really prime target for this, and people have cited cost, and he's saying, but in the whole scheme of things, this is a pretty minor investment to keep people safe, which I have to agree with. But then, like you say, with it being Europe, all buildings will be a challenge because
Yeah.
they're not designed with ventilation in mind. So I think it's interesting. It's the first time I've read of this, and
Hmm.
it'll be interesting to see who else adopts this kind of policy, because I think it's anything that helps people. It's a small tool to help people get comfortable with going out, so that helps businesses, etc. It also gives them it helps them get figure out if they want to go and do things, and brings us back a little bit more to normal life, just on the basis of a simple and cheap check. So
Yeah.
I
John, I think it's great already. I think I've seen a level of cleanliness drop here in the U.S. Just at least some of the places I'm going, I feel like they've completely abandoned some of the things that I actually enjoyed seeing, like cleaning the door handles. But
sure,
anyhow,
yeah, yeah.
no, that this is what an interesting read. Um I feel like it's I'd be at the restaurant looking at that level as like a keynote board or something, right? Like,
Yes.
but anyhow, John, let's move on to Indonesia, right? The next story is a neat one. You got Indonesia COVID deaths add to questions over the Sinovac vaccine, and that's the vaccine that came out of China, right?
Yep.
And if I recall, that one is a protein based. I feel like
Yeah, I'm not.
maybe not,
I honestly can't remember. Yeah,
maybe not.
it's
But anyhow, John,
yeah.
tell us a little more about how this is affecting Indonesia.
So it actually seems to be affecting Indonesia and other countries, or maybe pointing to issues in other countries. So in Indonesia, at least 10 out of 26 Indonesian doctors who have died from COVID-19 I think in June, had been fully
Oh
vaccinated with the
boy.
Sinovac vaccine, prompting health experts to consider whether medics should receive alternative doses to boost immunity. So in
John, I got
Indonesia
to
is a
stop you right there, man. That doesn't sound very good at all.
no, well, it really doesn't sound good, and this is a vaccine that really it was rolled out with. I mean, we've been, again,
Yeah,
talks about how lucky we are in the US. We've known about all the trials that have been done on AstraZeneca, Pfizer, Moderna. We've known about adverse events. We've known about the efficacy readouts. There's been the data, if you had the time to look at the data,
yeah,
to say how how these vaccines have worked. This is one of the ones I'm not sure. There's the Sinovac and the Sinopharm, so I'm not sure because one was basically rolled out to the Chinese army and used them
yeah,
as guinea
yeah.
pigs.
Like one of the
Um,
first ones, right? That was one of the
yeah,
very first like they said they had kind of won the vaccine race, right?
yeah, but then I mean, when you read on into this article, and this is the Guardian in this case, and it said that the vaccine was approved by emergency use by the World Health Organization, but that was on the basis of it prevented symptomatic disease in 51% of those vaccinated. So its efficacy numbers
Yeah,
were
it's low.
really down compared to the vaccines that we have access to here, and really just scraped over what the EMA and FDA had said they would accept in the early days of the of the pandemic. And so really this is one of the questions for countries that have relied on. We talked about China rolling out the vaccine to additional countries a couple of podcasts ago, and this really is it's basically raising an alert for those countries, because it's also several countries that vaccinated a large proportion of the population and used the Chinese-made Sinovac or Sinopharm vaccines as part of their inoculation campaigns have reported recent outbreaks. So it's not just Indonesia. This also infects Mongolia, Seychelles, Bahrain, and Chile. And remember, the Seychelles were cited quite early on because they had a very high percentage of their population were vaccinated, and this goes back a month or two ago. But they then had a big resurgence in terms of cases amongst their population. So it's it's really a governmental question. That it then talks about Thailand, but they've committed to buying the Chinese vaccine. So they don't. Is this going to be right for Thailand? Do they even have the funds to buy a
I
backup
don't know what
plan?
they're getting,
You
man.
know,
Like, we just think about like the struggle Emergent had here, and what are they making? What
yeah,
God bless
yeah.
the people of Indonesia and Thailand, and I don't know, man. This seems horrible to me. Just horrible.
Yeah, so it's a question mark, and it ultimately it still says that however many vaccines come through and are authorized, we still need to get them around the globe, because some. I mean, actually, it really does roll on to another question. That's something that might have seemed effective as more variants come out, and actually, this is part of it. Was part of the main topic, but as other variants come out, some of these vaccines that are authorized early on may fall by the wayside because they just can't keep up with the mutations of the virus. So it's something to watch and be aware of.
Yeah, it's to me anyhow, the mRNA is an advancement in technology, and it seems to be holding up, but there's still some time still needs to tell, right? But
Yeah.
John, next story is a real fun one. So again, the theme is we're going all over the world today, I guess, on our news, and so there's a crackdown on vaccine. I'm gonna maybe screw this up. Sommeliers, I guess you can say that.
Sommelier. It's,
Sommeliers. I do understand what it means, but meaning, so there's a crackdown on the COVID pandemic as it grips Brazil. So basically, people are getting kind of picky with their vaccine, and these, despite some devastating numbers in terms of like 500 million people have died, and the president has really come under a lot of fire, and now they got this. There's a new occupation. Tell us about this new occupation in Brazil, John.
Well, yeah, it's vaccine sommeliers who are basically looking out for the desirable vaccine to then alert others to where this vaccine is available. And people are actively turning up to appointments and turning down the vaccine because it's not the one that they want to have. Some of it has been driven by Bolsonaro, who it sort of says he quipped that the Pfizer vaccine might turn recipients into alligators. I mean, I assume he was joking, but it does sort of illustrate the power of, if someone is an authority in the country, what the effect of even a throwaway comment can
Yeah,
have on
yeah, like it
on
was like
on
the
on
bleach
on,
comment
his-
to
on
you.
his followers, because people are actively avoiding the Pfizer vaccine,
Crazy.
whereas others have decided that obviously the Pfizer vaccine, because of its 90 greater than 90% efficacy reports, is the one to go for. Others are distrustful of the Chinese Coronavac shot, which Bolsonaro has also had a go at Beijing, so that's the suspicion of China there. But it's one of those. It's as the I think someone says. The mayor of Rio says, we just need to get them vaccinated. We don't have time for this crap.
Yeah, I
To be
mean,
quite
look, the numbers are
honest.
staggeringly low, right? Like 13% of the population of Brazil has been fully vaccinated. 15% of Mexico has, so they're trailing them. Like half the UK in this article states like 56% of the Chileans. But more importantly, it's like a vaccine isn't like a bottle of wine. I can't believe I had to read that out loud, John.
Yeah, sure, yeah. So really, what's happening in a number of cities is that people who get to a vaccine appointment and they say, well, we don't have vaccine, they're going to the back of the queue, and actually in some places have been told they'll only be vaccinated once all over 18s have been immunised. So, I mean, they're trying to attach real consequences to basically clamp down on
Yeah,
this. But
too funny.
yes, yes.
Definitely a different world down there, John. And someday I'd like to go to Carnival. I think that would be fun.
There's no understanding other people. I think actually I South America's a continent I haven't been to. My parents, my dad actually taught on like sabbatical in Chile,
Wow.
and it was in one of the southern universities there. And so he and my mum went over to Chile, and they went to Argentina, Uruguay, etc. So at some point I would really love to go
Oh,
and
I would
visit
love to
those
go. Likewise,
countries.
never been.
They absolutely love South America,
Yeah.
and so I really at some point like to follow in their footsteps.
Yeah.
Hasn't happened yet though.
I don't know, John. I still want to float down the Danube, if you know what I mean. So anyhow,
Sure.
we're going to move on
Actually,
to our next. We're
I-
gonna,
this is why I'm so in favor of vaccination, because I want to travel again to sample all these countries. I don't want to be looking at countries saying, "Well, I can't travel there because the infection rate's too high, etc., etc., etc." I want everything to be
yeah, and
back to
I'm
normal.
like thinking about,
I don't.
I got a 20-year anniversary coming up, and we want to do something fun like travel down the Danube or something. So I'm hoping. Likewise, I hope sometime early next year that everything's open, or at least next summer.
Sure. Yeah.
So John, taking a little back on topic here, we got U.S. pauses use of Eli Lilly's COVID-19 treatment nationwide due to variants.
So yeah,
So
so this plays into the sorry to interrupt. This
no,
just
no, go
plays
ahead.
into the whole, really the theme of today's podcast. It wasn't. I didn't intentionally select international news items. They were just the ones that sounded interesting. But this is really one thing that we're there's more and more attention to variants in terms of how they affect different populations, and so the Lilly antibody cocktail that had been shown to be effective in treatment of hospitalized patients has now the FDA is now halting
Yeah,
recommended
they're
use of
just
it
not effective.
because
Yeah.
yes, but because it's showing that they're not effective against the P1 or B1351 variants. And I think that's alpha, and I'm not sure what the P1. I'm not sure which one that is, but the alpha one.
South
Oh no,
African.
B1351. That's the
Yeah,
South African.
in Brazil.
Um,
Yeah,
it's but that was a virulent one that we were concerned about. So if it's failing against that, then likely the delta that is becoming the challenge from India, as we'll talk about in more depth, then it really doesn't have. They don't have an application at the moment. So Lilly are sort of they. Basically, they can't really push back, and it's just saying that we will, in the longer term, be still look at this space and hope that we can roll out other
on the good
treatments.
side, it looks like Regeneron and Ver GSK
Sure.
combos are working though, so it's not
Mhm.
all bad. In fact, I think that
Exactly.
did I just
Exactly.
lead into our next story?
I think that's basically it. It's mixed news on the antibodies.
Yeah,
Lily's had its time for the moment, and it will take quite a commercial hit
for
in
sure.
terms of their what they thought potential outlook for those antibodies. But the GSK and Vir antibody actually looks like it could be a strong replacement, because it does have that ability to tackle the Delta variant.
Mhm.
So basically, the headline on this is GSK and Vir navigating early antibody pitfalls, touts Delta variant busting data for latecomer sotrovimab. And that basically is it's in phase 3 data is showing that this can deal with variants, because the antibody that they were going for was its point of attachment was really in the conserved
Mhm.
part of the virus. So the virus, the likely pieces of mutation aren't don't affect this the way this antibody operates, which
Yeah.
is why it has a longer term outlook.
And I think it says here their chief scientific officer said they were proactively looking at like 14 variants, so they got ahead of the curve, and I think
Sure.
it's paying
Yeah.
off for them. Yeah, good, well, good to know. So Ver GSK cocktail is pretty effective, neutralizing, like you said, everything you just said. It appears to be neutralizing against several variants due to the fact that it's in that conserved. I believe it's the spike protein that it's targeting. But John, very good stuff. This is good to know. Good to see. A minor setback for Lilly. I'm sure they'll dust themselves off and
Sure. Yeah.
try to figure out how to catch up to Ver. Right? It seems like they're in the Ver GSK somewhat ahead. Um, maybe
Yeah,
we'll.
so although Vir and GSK are also looking at second generation and beyond, because obviously it's they and so there's a couple of questions over the antibody drugs. There's been very limited pickup of them. Supply has been difficult at the moment. Vir and GSK do have a a stockpile available, but it really is how do we the part of it is they only had a short window of application for
Yeah,
mild to moderate patients. So GEAR and VSK are looking at, can we extend this into more severe cases and for it to be used for those kind of patients, so actually make these antibodies more applicable. So there's ongoing work in
and
this
I think it's
area.
slow. I just think in general, we're vaccinated. There is a decrease in COVID infections, and there might be pocketed outbreaks, but nothing like we had, a year ago or
Sure.
18 months ago.
Yeah.
So there's just
Yeah.
the number of people that might need these drugs is significantly lower. And then when you talk about being in a specific region, or a specific class, right? They got the 8 classes of COVID or something, 8 stages they have, right? So if you can only do a certain stage now, it just, it's actually not all bad.
Yeah.
Because to
And,
me, I think there is just the need for them is somewhat decreased. But
and this
John, like you,
and
I'm going to sleep better knowing we've got stuff that should something happen, should this come back, we
sure.
got immediate
Yeah.
things that can be.
And just to close out, this is their philosophy. Well, sotrovimab is basically a half-life extended version of a natural human antibody. The company has another prospect in the hopper, um, VIR 7832, which will be one to watch, which is built to be better than natural antibodies and could be relevant to more severe COVID-19 cases. Specifically, the antibody is enhanced to trigger T cells alongside the benefits of sotrovimab.
Mm,
The hope is that the drug would not only offer therapeutic benefits, but also confer a vaccine-like effect, potentially
mm.
making it a meaningful weapon for prevention. So, yeah, again, I love seeing how these companies are thinking long term and what can we do to really address this.
I like the idea of trying to be better than natural antibodies. Good luck with
There you
that
go.
one. Yeah, no,
Yeah,
no.
yeah. Oh,
I think it's the first time I've read something quite like that. Right? I mean, I think maybe everybody who makes a humanized antibody would say, "Oh no, it's better than a natural antibody." But fantastic. Love the fact they got something behind it, and clearly they're emerging as a leader. Although
sure.
careful when you use words like enhanced to trigger T cells. That can be dangerous, John.
So, like I say, it could be one to watch. It could be either good news or bad news. So we'll see. So let's move on to the non-COVID because
Yeah.
again,
You got something fun?
this. Well, you'll enjoy this.
Yeah.
I'll shut up because I know very little about the
Well, I
subject.
don't think
But
any of us know
but
a lot about
but
CRISPR,
actually,
but yeah.
but I honestly, you read an article like this and you know this is a big deal. This could be a big
Yeah.
deal. It's that first step to something really significant, and it basically is hitting landmark milestone. Intellia shows CRISPR can edit genes directly in patients, and my understanding is that CRISPR therapeutics that have been applied to date have required cells to be taken out, they're edited and then re administered
Infused.
to
Yep.
the patient, and that's the way it's done. This is one, but the issue with that is that isn't really meaningful for many these disease states that could actually benefit from CRISPR. So this is the first time where they've actually administered the gene editing technology into the patient to address a condition, and they've
Mm.
shown efficacy for it. And just quick bit of background: Intellia is actually founded by Jennifer Doudna, who is one of the two 2020 Nobel Prize winners for their work on CRISPR. So this is where her company is going. So I will, and just to say, here's what they did: they used CRISPR/Cas9 to cut the gene out of the liver cells of patients with ATTR amyloid Lordosis, a deadly disease where a misshapen protein called TTR builds up and damages organs throughout the body. Patients who received a high dose of the therapy saw their protein levels fall between 80 and 96%, indicating the therapy permanently cut the genome where desired. I mean, what it means, there are actually therapies out for that condition, but for treatment of those, I think it's an infusion once every couple of months. I can't remember the
Wow.
once every 3 weeks. Sorry, that's an infusion every 3 weeks, whereas this means a once in a lifetime administration if it works. So that's how huge this could be in terms of for those patients. But in terms of for CRISPR, that direct administration is a big deal. And as I'm a complete layman on this subject, I will back off and let you say what you want to say on this.
Yeah, I mean, John, there's it's fat. I mean, it is like sci-fi technology to be able to, systemic, well, not systemically, but targeted, gene editing like this is, and really some of the more challenging diseases, such as, um, muscular dystrophy and sickle cell anemias and things that are just, um, sometimes the therapy might work, but over time, ultimately they kind of stop working, right? Because they're just genetic disorders, true genetic disorders, and to have something that can augmented at this level that they're doing is just unbelievable. It uses some form of like an RNA lipid nanoparticle after the gene editing process. That's how they're delivering the gene. I mean, it's like 6, 7 different technologies all coming together in our lifetime, right? And so this is incredibly powerful stuff. I will say there is a small caution, right?
Hmm.
Because this is still somewhat in that there have been some preclinical studies that showed that when the gene editing isn't as specific as it should be, or the gene cutting, and that can have some side effects. Although they seem to have overcome that with this iteration of their CRISPR technology, because that was always some of the early challenges.
Sure.
It
Yep.
would slice at the part of interest, and then remember that thing's still active, and maybe it would non-specifically cut something else, right? And so now in this case, they haven't seen that, which without looking, they must have found some way to kind of try to either prevent that or, um, you know, address it. But
I
the
think
the other
I
thing,
think that
I'll add one last
they
thing. This
sure.
rivals Alnylam's drug, is what they say here, which is really the first, RNAis that hit the market. But that is one of the things you mentioned that had to be given, kind of repetitively, where this is maybe a one-time dose. So great stuff, John. Yeah.
Yeah, I think they obviously they have paid attention to that concern about if once it's done with the site, does it move on to other things? So the basically after the liquid nanoparticles are administered to patients, they go to the liver, express Cas9, which slices the DNA, and then flush out within hours. Actually, they designed that nanoparticle to be rapidly eliminated. So obviously that I didn't know as I was reading the article, I was thinking why were they aiming to do that? As you're saying, that potential for hanging around and going to sites where it's not wanted, I assume is where they're applying that to really get it in and out as quickly as possible, and that's the way they're thinking with this.
Yeah. And then Harvard biochemist David, I think it's Lau is how you say that, who co-founded CRISPR, Beam, and Prime, those companies. He
Yep.
says something powerful. This serves as a compelling reminder that the era of in vivo therapeutic human gene editing is already upon us. He said that well, John. That is a very true statement. I love it. I mean, from my early 90s working on autologous T cell therapies, where we were doing some, it technically fell into gene therapy at the time because we were manipulating people's T cells in a very non-specific way. Didn't really have full handle on what we were doing, but having some efficacy and reinfusing them back in. And then flash forward 20 something years, or maybe more like 25, a little more, 26 or 7 or whatever it is. But here we are. It's upon us. I mean, this is right in line with, where the CAR T cell therapies are booming. CRISPR's right behind it. They're kind of coming together. I think that it'll just continue to be an exciting time to be in research and drug development, John. It's just unbelievable. Just I'm speechless, John.
Yeah,
It's like England winning the European Cup. That's how I feel right now.
Yeah, well, I mean, from my perspective, as someone who's come at things from a strictly small molecule background, though, this is like science fiction coming to life. It really is. It's just amazing once get into this and read more about it. So yeah,
Yeah,
very,
it
very,
even
very
caught you off
impressed.
guard because you were like, "Well, why do they want to get rid of that thing?" And then I'm like, "Oh,
Yeah,
there's this side." You're like, "Oh, that makes
oh,
sense."
yeah,
It's
absolutely, yeah,
it's
yeah.
you don't have, it is so much fun to be reading about this stuff and to be even John, these are the type of clinical trials as they get in, we'll start to support, right?
Yep, absolutely.
We're
Yep.
set up to support these types of works, and certainly um, more to come. And I think there's quite a few CRISPR companies that are probably moving into preclinical or moving out of preclinical into clinical. This is one of the first clinical trials I've read about
Yeah.
with
Yeah.
respect to
Yeah.
CRISPR
Yeah.
technology. And again, I can't believe how fast it's coming. And normally
Sure.
I would have been like, well, he and harm, but after what we've seen with, I feel like the vaccines, I think we've been cautious, which is a good thing. But I do think this is helping science across the board. COVID has had a lot of impact on helping move science. So, John, great stuff. We got one
Just
more.
Yeah, just one very, very quick one. I think we talk about investments occasionally, but I thought this was a good
Mm.
thing to focus on. That Sanofi commits $476 million a year to mRNA vaccine center and race to expand tech beyond COVID-19. And really, to me, this is an indication of if this is the way things are going, mRNA is here to stay. They've obviously shown success with COVID, with the BioNTech and Moderna vaccines. This is Sanofi, who you'd consider a more traditional vaccine company, are now obviously planning to invest substantially just to look at vaccines dedicated to the mRNA approach. And like I say, Sanofi have been a powerhouse on the vaccine front, so it really says where the direction that the vaccine portion of the industry is likely to be going. So I thought it was an interesting footnote to what we've been talking about.
Yeah, no, it is definitely been a nice run, John. So with that, not a nice run, but the Johnny come lately, the second to the game, Sanofi is doing the right thing to me. I don't believe anything. They are seeing the future, and I think you're going to see a lot of your big pharma companies start to move into it. So, and then those that are in the space are gonna just skyrocket. I'm sure anybody who's in to mRNAs is probably getting um, some sort of large pharma knocking on their door, seeing it, sniffing around, and more to come. I'm sure we'll see more, not just investments, but partnering and acquisition wise. But Sanofi's doing the right thing. That's absolutely what they should do. The future's upon them, and they need to get on that train. Yeah. And it's
Exactly.
and as somebody who, as we the consumer of this stuff, right? This is good. We want that. We want
Yeah.
more people throwing their hat in the ring. So, all right, John. Well, we've got
Yeah, I read something in passing about I think it was an MRA for one of the tropical diseases yesterday. I don't know if it was definitely that, so I'm not going to say much more. But yeah, we're going to hear more and more on this front. So anyway, I just thought really it's good to see that the industry getting behind this, because obviously they see where we're going with this, and it can only be good for us as the consumer, and hopefully stamp out other diseases that are more chronic than COVID. COVID's our immediate emergency, but there's a lot of other things to be addressed out there,
yeah.
particularly in developing nations. So yeah,
Well, John, historically, always during tragic times, wars and pandemics, that's when science advances the most, and that's a
sure,
sad.
exactly.
It's collateral. It's collaterally positive, but it's a sad thing that it takes some of these catastrophic things to get such, focus and movement on it.
Yep. So let's move on to the main topic. Just to set the scene a bit, we thought we'd talk about it's starting to come out in the news more and more, just the evolving challenges of COVID with the emergence of the Delta variant, and it's sort of we talk about viruses, etc., and there's been the variants that have popped up throughout the life of the podcast, but this is the one that is the latest concern that we're seeing in terms of infectiveness. It's the one that is really a concern of any country it's moved into. Um, uh, that- Obviously, my background is coming from the UK, and I always watch what's happening in the UK. As a country, it's done very well in terms of vaccination, etc. But um, the Delta variant got into the UK a month or so ago, and what we're seeing now is another wave of cases, where actually the cases in the UK are daily new cases are at a level not seen since January of this year, which was when they were coming off the back of a really huge spike in that sort of lead up to Christmas, and coming back off that. So it's showing that, even though you've got a vaccinated population, there is a variant that is of some concern. This is not to scaremonger. This is just to give some background to. We thought it'd be good to how give the background of why mutations occur and what this means, and but ultimately the take home message is, we're moving in generally the right direction as more and more people get vaccinated, and it'll decrease the likelihood of these kind of variants occurring. But we just thought it was a timely topic to talk about in this podcast. So I think, as I've got a number of things to touch on, but first of all, let's just talk about mutation. It's just what viruses do. They naturally mutate as they spread through a population, and they'll occur when the virus makes contact with a host and starts to replicate. And it doesn't always replicate the same way. So some of the changes in its sequence will happen as it replicates. Some of those some of those changes will make it less effective. Others will make it more effective, and that's what you don't want. But it's just a natural thing to occur with any virus. And I'll let you go from there, Dominic.
Yeah, I mean, I think what we don't want to do is, like, scare everybody so that they're not leaving their homes again for a year because of the Delta variant. But to your point, things mutate. We live in a mutating world. The good thing is your immune system will catch up, so don't panic, especially if you're under the age of, say, 70, and you got a pretty healthy immune system, so you're going to be just fine. But it is interesting to see how quickly this is sort of spread, and even in my mind, just reading some of it says India in December of 2020 is when the um, Delta variant was first sort of identified in India. Talk a little bit about that, how you identify them, which is fascinating, right? But it was identified in December of 2020, and that, I'm like, man, that's 7 months ago, and it's now like way more infectious, not way more infectious, more infections, right? It's more,
Yep.
and it is more
Yep.
transmissible. It is more infectious, and I don't want to scare everybody, but it's clearly moving its way ahead in not just the UK, but US and everywhere. It's the dominant strain now. And I'm thinking, I don't, John, I didn't think we were traveling. So I'm like, what is going on? How is that? So that's, but that's a little off topic. I'm like, I guess, I think is the UK taking people from India? Maybe people, I guess we are
Yes,
going to
yes,
India. I don't
yes,
know. Like,
yes, yes. So actually, this was the subject of some controversy at the time. I think it was around April time. The UK was really keen to have a trade deal with India, and so they have that, obviously, this evolving list of green, yellow, and red, countries that you can and can't travel to. And so this April's around the time when things were really bad in India in terms of the daily cases and daily deaths, and there's some shocking photos out on the internet during that time. And so there was a lot of discussion about we should not be having travelers come in from India that time, but the government were actually holding out to actually maintain travel in from India.
mm,
And so I think the UK has seen the consequence of that. And
yeah,
once people are in the UK, then this is part of the issue of being a global economy. Everyone moves everywhere, and although, like, you and I haven't done much travel, there are obviously people who are
yeah, they
traveling,
are. And like,
and so that's how these things
I
happen.
mean, and it makes sense too. Think about it. If you hadn't seen, some people go back to see their family maybe every 2 years or something, and say you hadn't gone back in 2 years, and then COVID hits, you're up to three, it's four. So the moment that opens up, people want to get back
Yeah.
and see their
Yep.
parents. I mean, I get it, and even some of our colleagues at work have. Now that I think about it, I know of a few people that have traveled to India, right? So it's not. It just struck me. I know it's a little kind of tangential, but it just struck me like, how quick it kind of happened in a time when we're not even traveling. What would be happening if we were traveling, right? Like, oh my goodness. So,
Exactly. Yeah. Yes.
but more importantly, I'll take 1 second. The good news, both the Pfizer vaccine is 79% protective and 88% effective against symptoms. That's fantastic for the variant, as well as AstraZeneca is 92% in stopping hospitalization. So, John, there's the saving grace on
Sure.
just the,
You
we're talking about um, mutations. This is, we're emerging of the Delta variant. That's our portion. You talked about how quickly, I think, and you did a nice job of kind of saying how, mutations are kind of naturally occurring. Don't panic, right? So John, where do we want to go from here?
Sure, sure. Well, yeah, we're jumping around, but to talk about the mutation of COVID-19, let's get it back a little bit back. It's a relatively slow mutation, compared to influenza, and we've touched on this in the past. That I mean, even if we talk the variants of concern, we haven't really seen that many variants of concern on COVID-19. But if you compare COVID-19 to influenza, we have a different vaccine every year because it mutates so quickly. Um,
It's a
it's
good
sort
point.
of
I think that's important to note for people who are incredibly worried about it. Despite the variants, it's really not even nearly as um, variable as influenza is.
Sure, and this is one thing I didn't know until yesterday, but it's an RNA virus like the flu and measles, but it's more prone to mutations than DNA viruses such as herpes and smallpox. So it's the type of virus you would expect to mutate, but like I say, it doesn't mutate as quickly as influenza. But we have the tools to look out and track for new variants, which is obviously an ongoing project. And like I say, it's just this is natural. Some mutations help the virus, others don't, and the delta is one that helps the virus right now. But we have the tools to work against it. So I think our next topic was how the variants tracked, and um, what I mean. This is all down to genome sequencing, and I'll
Yeah,
let you.
John, I think this is something that, I spent a little time kind of talking with my wife last night, and even sort of didn't get time to research it as much as I'd like, but um, and then of course someone shared a story with you and I about how they tested positive and how that all went down, and then I just said, hey, did you ask what variant you had and stuff, and the answer is no, and I'm like, who would ask that? My wife was even like, what more you're she's like, no one would say that to their doctor, and I'm thinking, well, why not? Like
Yeah, sure. Yeah, right.
I'm like,
Thinking
oh,
that
why
way.
wouldn't you say?
Yeah,
And so then when we see, even now when we see these percentages and what it's all, you just know nobody's doing high sensitive PCR tests, because that's what it would take at this stage. I know, and we're gonna, maybe I can just jump in that there's demonstrated efficacy of being the same between an antigen test and the PCR, the molecular test. They actually show similar sensitivity, similar percent positivities and false positive, all that stuff. They're right on par. But I quite, that's a bulk. So how this works is most PCR tests are going to look at all whatever is available. It's probably designed to just say plus minus against any COVID, not necessarily the variant type. That's an expensive test. You
sure.
know what I mean?
Yeah.
So that's where it comes. Economics plays a part on what we know now. And then in terms of actually discovering them, see, that's the other piece. That is again more of a screening that comes into more some in silico that people are trying to predict it. They have some artificial intelligence even to sort of say, oh, where would the delta jump from, or where would the alpha jump from, and then they create primers, and then they screen and they say, oh, I got a hit, right? So it's just like that's true viral discovery, and that is something that um, we're right. That's where you go from research into that development phase. So the reason why I bring it up is, as a drug development company, John, that is going to be something that, and we talked about this, probably in the future, in a clinical trial, say I have a heart medication, I might want to know what, if they're COVID positive, and more importantly, I might want to know what variant they have. So that I could envision, as we start to bring on molecular testing, we may offer a COVID mutation panel. And that's
Sure.
something that is very powerful in terms of, that's expertise in terms of sensitivity. It's going to be some intellectual property in terms of, can you do a cocktail that's doing 5 variants versus 10? That's where your gene jockeys become your experts. And that's a little bit outside of my expertise. I'm going to stop right there, but I hope what I said made sense in terms of how this might continue to be at the, I don't know about the forefront, but it is something that I know if I were in the biotech section or the pharma section and I'm in a certain area, I would want to know or potentially want to know what the COVID state is, especially if it's, we'll see what happens over time. I mean, we could be right now we're seeing kind of pockets of it here and there. It certainly doesn't seem like it's going away. If the vaccination rate only stays at like 60-70%, it's not going to go away for a few years.
Sure.
So I just think
Yeah.
it's lingering.
Yeah.
Sorry for going on
Yeah.
a little diatribe there, John.
But I think though it's interesting you said about expensive and time consuming in terms of the test to figure out variants. I mean that's going to drive your technology companies because if they can come up with a way of doing it quicker and cheaper, that's money for
Yeah,
them. So it will actually help instrumental development, and that in turn
yes,
helps us
the
because if we have
the
access to cheaper and more efficient instrumentation, that's where it all comes from, and that's what drove bioanalytical LCMS
yeah,
was. Once you got that ion spray interface that meant you could run instruments overnight to run samples, suddenly you had the ability to support clinical trials much easier than you'd be doing before. And that's where a whole industry came from. So it will help drive that kind of stuff. So moving on from that, because I think we will touch on that a little bit later, but I want to actually talk about the Delta variant. And this was interesting to me because we think about the symptoms of COVID. The one that I always thought, because it's so different from so many other viruses, etc., that loss of taste and smell. But in terms of, so backing up a bit, like you mentioned earlier, the Delta variant emerged in India in December 2020, and they think it's anywhere from 30 to 100% more infectious than Alpha,
mm,
which is the UK variant, with theories that changing variant protein makes entering cells easier with additional mutation allowing blending with cells to infect more cells and overpower immune systems. Here's just a couple of quick things around it. It seems to affect young people more, with children and people under 50 two and a half times more likely to become infected. So this then again points to the need for vaccination and getting it into the younger populations if possible. We've got it. We've got the Pfizer and Moderna vaccines authorized for 12 to 17-year-olds. The testing for them in younger populations is critical because obviously that helps us get to that 70%. Although I've seen reports that with the Delta that the herd immunity threshold might not be 70, it might be raised because of its infectiousness. But what I was really sort of blown away by, there's a tracking app in the UK where people can report their symptoms, and like say, UK is really grappling with the Delta variant right now. So it's saying that cough is becoming less common, and loss of smell is no longer listed in the top 10 common symptoms anymore. It's actually things like runny nose, fever, sore throat, and headache. So it's almost more difficult to
yeah,
differentiate from what you consider flu and cold. To
jeez,
me, it was like the loss in smell and taste was such a signal of if you had
yeah,
that, you had a really strong indication.
it did,
And like you were saying yesterday, you talked to a colleague who had COVID, and when they were talking through symptoms, they mentioned that loss of taste as well. And I'm like, well, you haven't got the Delta
yeah.
variant then. That's good.
Made her feel real comfortable with that. Yeah. No.
But but ultimately, that is a good thing because it's the less that if the person's got it,
Yeah.
it's the less virulent form. So it's yeah.
I mean, when you talk
Anyway,
about runny nose, itchy eyes, fever, that's like, isn't that almost everything from the cold to everything, right?
exactly. Yes, exactly. So
Uh,
it will be a little bit more to track on that. So yeah, in terms of where the where the Delta variant is, obviously we talked about the UK. Israel saw fresh outbreaks, and again that was a well vaccinated population
mm,
seeing the effects. In the UK, there is concern because we've touched on the Euros, multiple times during this podcast. Scotland saw an uptick of COVID cases after the Scotland games versus England and Czech Republic.
yeah.
So we've seen big crowds at stadia all round Europe. So we don't know what that will mean. So that's going to be something to watch. And Imperial College London said that the reproduction number is now 1.44 in England, meaning 10 infected people would pass the virus on to 14 others on average. So they're looking they're in that stage where they think it's going to be a fast growth of the epidemic again. Um, but then, in the UK's usual style, the government have announced that they plan to open everything up on July 19th, which makes no sense when you see data like this. So again, I will back off from the UK and watch with interest. And when you talk about visiting to see friends, I mean, our family after a while can understand how people travel to and from India. After watching that England game yesterday, my first instinct was to send a text to my best friend in the UK, was my best man, years and years and years ago, because we always used to watch England games together on the TV, and we watched them stumble at quarterfinals, semi-finals, and repeat tournaments. So to finally see them go to a final of a tournament, it was a huge deal, and so we had this sort of virtual celebration on the phone together. I would love to have been in England
Yeah.
having beers with them and watching the game together, but obviously that's not something we can do at the moment. Anyway,
No,
that's
and you talk about, I don't know if how much our audience knows about the Euro Cup, but stadiums were packed, but they were also, you had to be vaccinated. So I hope the outbreak isn't bad. It doesn't surprise me that there was a spike,
I
because even if they're
yeah.
vaccinated, they come back. Anyhow. Um,
I wonder if it's more, but less the stadia than actually all the public areas where people were gathering. They definitely loosened
Well,
restrictions
they
in
did.
the
They had
UK.
to be back. They were only allowed in the country for like 6 hours, John. Like when they played in Hungary, or whenever you weren't allowed to stay very long. They had trains and buses, and within a couple hours after the game, you had to get out of the country. So interesting, fascinating stuff. But let's move on to our next topic. And we're going to quickly go over this one. It's the impact on the patient population,
Yep.
vaccinated versus unvaccinated. Tell us a little bit about that.
So you touched on this earlier. Basically, we've talked about this repeatedly. Getting vaccinated is your best bet in terms of protection. 2 doses of the Pfizer BioNTech is shown to be effective against the Delta variant. So AstraZeneca has as well, and I've got a very quick sidebar on that. And then J&J vaccine has also been shown to show strong persistent activity. On the AstraZeneca vaccine, I spoke to my friend in Madagascar who is, I think, getting vaccinated today with the AstraZeneca, but it was from the Serum Institute, and so he was concerned what that would mean in terms of travel, because the EMA has they've got a vaccine passport, but AstraZeneca vaccines on it, but not the Indian produced version of the AstraZeneca vaccine. And it's, at least from what I read last week, it's purely because the Serum Institute haven't applied to be part of that, and so they are looking at how that can be resolved. So he was like saying, "Well, should I take it?" I'm like, "Absolutely,
Yeah.
take it,"
Yeah.
because it's effective, and there's quite a bit of travel between India and Madagascar. I mean, there's a port on the east side of the island that that's where a lot of goods come in from India. So when I'm reading things about the AstraZeneca vaccine being effective against that, I'm saying, yeah, please get there, please take it. So my texts have been a bit preachy recently. Anyway, to move on. It's basically, it's that you think people are a little bit more vulnerable in terms of one dose, and obviously if you're unvaccinated, you are very vulnerable to this. That's why really the take home message is get vaccinated, and do what we can to build towards herd immunity to really help people
Yeah,
here.
and John, I think for the sake of time, we're gonna kind of wrap up there, and really, if it's okay with you, we're just gonna jump into our um, feedback questions that we got in terms of from one of our listeners, and he asked a big question. I think it's a nice segue into this,
Sure, absolutely.
and so he says, "Hey Dom, we had a vaccination conversation back last year. I'm curious your thoughts now, especially related to the mRNA vaccines like Pfizer. I finished my second shot last week, but we had a lot of friends and family question why I would do that. I'm curious, did you get vaccinated, and what about your children?" The answer is yes, as I think the audience knows. I got vaccinated some time ago, but then the bigger question is the children one, and that's where, in speaking with my colleague, we had some back and forth, and I think even after reading this, there's a real, in one of the articles, John, it's a virologist from Rockefeller University says it very well. He says, if you're unvaccinated, you will get infected and you will have a higher probability of ending up in the hospital. Vaccinated
Yes.
people might get infected too, but they will deal with it a lot better. And then if you weigh that with, okay, do I want a hospital visit or not? And I know the answer for me, John. I do not want to go to the hospital. So
Absolutely.
that's a huge vote yes for the vaccine. And then it's like, well, what about these side effects? Well, John, those side effects to date are still pretty far and few in between. And I have
Yep.
seen some real tragic stories about some of that, but they're very low in number. I truly think, and remember, somewhere in there has to be people. People are still getting sick with disorders, and so it's still not 100% causative that somebody who was somewhat healthy has deteriorated. And is it a natural thing? Is it the vaccine? And we can go back and forth, but that small percentage versus winding up in the hospital, I'm getting the vaccine. So then it
Exactly.
brings it
And
just go ahead.
if, like I mentioned to you on Tuesday, I mean, you're going to expect some side effects to vaccine or reaction to vaccine. And there was someone I know from Hereford who basically posted on Twitter that she'd had the COVID and she had the whooping cough vaccine, and actually the side effects from the whooping cough vaccine for her were much more extreme. So it's something to be expected, and the real severe effects are mercifully rare. And that
Yeah.
I think in terms of these vaccines, I understand the concern, but I really would not want to be hospitalized with the possible potential outcome from that.
No.
As I think that's much worse.
No, this is the reason why I get the flu vaccine. It's the same idea at this stage in terms of risk. There are still adverse events against the flu vaccine annually, and we're not going to stop the flu vaccine, right? So, um, then the real question is children, and
Yep.
this is something that has been a very big topic as we get closer to school time. Um, my son initially had been on the no because most of his friends hadn't, but like half of them were kind of getting vaccinated. So he's now um, more than likely going to get vaccinated. He will want to get vaccinated, I believe, before school starts. He's still somewhat on the fence, but we'll probably before he gets into school, we'll get him at least his first dose. And the other piece I want to mention is you can't go to college in the U.S. without getting a vaccine, John. Just so you're aware of that. There's very few universities that you'll be able to go to in the fall without a vaccine. So
Sure.
and I don't know how a lot of people might be torn. I'm okay with that. Like we have at some point. I love liberty. I love freedom. But at some point, there's and I understand there's even some people are going to get it and they might have some collateral damage here, and I feel horrible for that. But John, it's the right thing to do. These universities
Exactly.
these kids are on top of each other. They're
Yep.
already somewhat run down. They're out late. They're making bad decisions. So they're going to put themselves in more vulnerable positions. So it's just it just makes so much sense. Sorry to like
No, yeah,
it frustrates me a
I
little bit when I hear, oh, this isn't right and it's like, look, you're endangering everybody else if you don't do it. That's how I kind of
yeah,
see it.
if I could quickly chime in there, I mean, ultimately, before COVID-19, if you went to college and school here as well, you had to have a full record of the vaccines that your child had been taking. If there were things that were missing from that list, they wanted you to take them. It's weird the way COVID has changed that
Yeah.
discussion. That suddenly it becomes a choice whether I have it or not. It's
You're
like,
right, John.
why did you never pushed back on this
Yeah.
before? What is it about this virus that
I don't
makes you
know.
want
It's
to?
it's this concept. Sorry, I'm talking over you. I think it's the
Sure,
concept of we're losing our liberties. It's this we're so polarized, right? But like you're absolutely right. You can't go to grade school without measles, mumps, and rubella unless you got
sure.
some sort of petition for religious regions. There are some relief here, but you nailed it. Historically, and now that I think about it, certainly every university I attended, I had to provide a shot record, John. I
Mhm.
had to have the TB shot if I was, and in fact, sometimes you had to get a shot. I remember getting shots to get to college, right? So
Sure, absolutely. Yeah.
anyhow, it's a good point, and so I think to my colleague, I want to say, I hope we gave a good answer here. I'm becoming more, and then even part of the story we covered, where people are mixing and matching the vaccines and still not having really major adverse events. That means even more confidence in what we're getting here in a regimented style. And then, John, I don't know if we want to touch on it real briefly, but Pfizer's on the verge of getting fully
Yeah,
approved, and that
absolutely.
should
Yep.
change things. So we're running real short of time, John. Um, any last thoughts on the question from our colleague, or otherwise, I'll ask you about your weekend.
I think we covered it pretty well, and I'll tell you about my weekend, because the weekend is going to be nothing much until Sunday afternoon at 3 o'clock, where it's going to be England versus Italy, and hopefully England finally win a trophy for the first time in my memory. Because I although I was 3 years old with the 1966 World Cup final, I don't remember anything about it.
Wow.
So I really hope that England can do it, and we have something to celebrate.
And I've enjoyed Italy. I've enjoyed Italy winning a number of cups in my lifetime here.
Absolutely,
Even remember
yeah.
one, I think it was in 82 or 80. No, was it 80? They won the
82,
World.
possibly.
What was that?
I think it was possibly 82.
I think it was 82. I think it was the 82. And just because I grew up near my family was from the North End, it was wild. That's the Italian part of Boston, right? So it was a real kind of, anyhow. And I lived in Spain, so I do have some attachment to the Spanish team. I lived there for 3 months, but I'm a little torn, John. Normally Italy's my team. Like I have been up, my wife's seen me on the couch at 3 a.m. watching them play in South Korea at times. So, they're my team.
England are overdue.
I know. I'm torn. Like I said, I'm torn.
To be honest, I really like this team as a set of players. I love their team mentality.
I do like this team.
I love the way they all hang together, the way they're always looking out for each other. I think
I like Kane and Sterling. I agree.
But they park their egos at the door, and they are a team. And for that perspective, I really want them to succeed.
And I like Harry Kane a lot. I'd love to see him have some glory. He hasn't done. Exactly. He's been so good, and the Spurs have fallen short. But John, I'm going on vacation. I'm going on holiday. I'm going to go to the Jersey Shore for a week. My brother's family, one of my brother's families, and one of my wife's families are coming down. So there'll be, 13 or 15 of us kind of tooling around the Jersey Shore area. We're staying nice little place. I leave on Saturday, so quite excited for that. And then I'll share I got some tubing in over the 4th of July. And then we put on a good 3-hour fireworks show, and it was just awesome. It was so much
fantastic.
Fun. So with that, John, we're right up against it. Thank you for listening today. And actually, we'll podcast 45. I think we have a special guest, right, John?
Yep, hopefully. Yes, we'll see how that goes. Yep. Talk to you next time.
Yeah.
Thanks a lot.